Making man whole means providing care not just for the physical, emotional, psychological needs, but for the spiritual needs as well. We imagine an average medical professional will spend anywhere from 50 to 80 or even 100 hours a week in the context of medical practice. And yet historically, traditionally, we have often seen our ministry as being something outside of the profession, something we do after hours. And one of my growing convictions as I began to go through the clinical years of my training process was asking the Lord, how do we redeem those 40, 50, 60, 70, 80 hours of the time that we are in fact in the mission field? You know, how do we bring Christ into the picture when a patient walks in the door, when we're making rounds, when we're interacting with the colleagues and staff? Where is Christ in this picture? There's something wrong about that. You know, we could come and give them a prescription and we would go away and things haven't really changed unless they could discover the transformation that can occur when Christ comes into their life to give them the power from the inside out, to being to change their lives with a source of power that they couldn't have on their own when they're caught up in this vicious cycle of health and poverty, including spiritual poverty. I knew I wanted to do something more. I realized that I could be doing this on my own for the rest of my life and make a very little impact in terms of kingdom impact within the healthcare profession. And I realized that I needed to mobilize others to be involved in this process, a model of community health development that has been replicated not just in the Philippines, various places in the Philippines, but really all over. We have taken some of this overseas. We have probably the most difficult training that we have conducted has been in the communist country. It is illegal for doctors to share their faith. There was a lot of fear of the consequences if they shared their faith in public, and the fear that it was something that would never work for them because they really had never seen people come to Christ in the context of the practice. So it was with great resistance after 4 days of training, it culminated in the field practicum that every training conference occurs, and actually test them with real-life patients, typically in a hospital or clinic setting. Because we quickly came to recognize that for the majority of healthcare professionals, even though they come to one of our training conferences saying that the reason why they never shared their faith is because they didn't know how, the real issues really were internal issues. There were internal faith barriers. And unless we help them to overcome those through taking a step of faith as part of the training experience, nothing really happened. But this time we didn't have hospitals assigned because we couldn't ask anybody for permission. And so we, as we always have to do in a setting like this, we realized it's a spiritual battle. The enemy is not happy, and this is where he's drawing the line. So we put all the doctors in buses, and we would go around the city and drop 4 or 5 doctors off a half a block or a block away from a hospital, and they would just basically saunter into the hospital casually and then to go into the wards and began to share their faith. And we'd go around the city and drop just small groups of doctors all across the city. And obviously they went with great trepidation, but as they began to see people coming to Christ, patients coming to Christ, they got more and more excited, and they became more and more bold in their witness to the point where they, I would say, lost control. And they began to grab people, cleaning ladies that were on the floor. They grabbed nurses, they grabbed doctors, whoever they could find, and began to share their faith openly, whereas hours before they were so fearful of the political consequences of sharing their faith. And in fact, coming back then on the buses, they began singing "Onward Christian Soldiers" and sticking their arms out the buses. And the bus was going right by the communist headquarters. And the soldiers that were guarding it, they were totally startled to see bus after bus of doctors coming through singing "Onward Christian Soldiers." And it was a great transformation in their thinking. The more exciting part is that during the interim years since we've been there, the doctors have actually taken the curriculum and trained hundreds and hundreds of doctors on their own, simply taking the same training concept, now approaching their practice with a very different mindset, seeing that as a mission station that God could use to reach people for Christ, whether you're talking about colleagues or patients. And so we realized how critical that was to help them come to the point of not just saying that this is possible, but God can use me too. Because oftentimes people, when they first hear me share my own experience, they will either say, well, Young, it works in the Philippines, but it doesn't work in the US. Or they'll say to me, Young, it works for you, but it doesn't work for me. Or it works at Loma Linda, but it doesn't work in Timbuktu, where I work. And it is until they go through the field practicum and are able to say, yes, God can use me too, that they come away with a totally transformed mindset and a totally a different faith perspective of transforming whatever structure that they're a part of within the medical system, providing care not just for the physical needs, but for the spiritual needs as well.